Why is airflow limitation important for COPD gold staging? Imagine trying to breathe through a straw that keeps getting narrower. That's similar to what happens in chronic obstructive pulmonary disease. Airflow limitation is at the heart of this condition. It means air struggles to move freely in and out of the lungs, making breathing harder. To measure this, doctors use a test called spirometry. It checks how much air you can exhale in 1 second, called the forced expiratory volume in 1 second, or FEV1. They also look at the total amount of air you can exhale, known as the forced vital capacity, or FVC. When the ratio of FEV1 to FVC drops below 0.7 after using a medication called a bronchodilator, it confirms airflow limitation. This measurement is key to understanding how severe the disease is. The GOLD staging system uses the degree of airflow restriction to classify COPD into 4 stages. If your FEV1 is 80% or more of what's predicted for your age and size, you are in stage 1 or mild. If it's between 50 and 79%, it's stage 2 or moderate. When FEV1 drops between 30 and 49%, it's stage 3 or severe. And if it's less than 30%, it's stage 4 or very severe. Why does this matter? Because the more airflow is limited, the worse the symptoms tend to be. You might experience more shortness of breath, cough, and fatigue. It also means a higher chance of flare-ups, which are sudden worsening of symptoms. These flare-ups can lead to hospital visits and complications. Knowing the airflow limitation helps doctors decide on the best treatment plan. For example, someone with very severe airflow restriction might need stronger medications or additional therapies like oxygen. Even though symptoms and how often you have flare-ups are important, airflow limitation remains the main way to measure and track the disease. It gives a clear, objective picture of how much your lungs are affected. This helps doctors monitor progression over time and compare your condition with others. While symptoms can sometimes seem out of sync with spirometry results, the airflow measurement stays as the foundation for staging COPD and guiding treatment decisions. It's like having a reliable map to understand how the disease has advanced and what steps to take next.